A half-hearted effort to stop the bill won't protect millions of Americans from losing their insurance and, ultimately, from being denied medical care. The Republican healthcare bill, now sneaking its way through the Senate, has a good chance of becoming law, even though it would do miserable damage. And it has a good chance, partly because some of the bill's most influential opponents have not had the courage of their convictions. I realize that sounds harsh. These opponents generally have good intentions. But they haven't been very effective so far, and they don't have much time to summon the courage to become more effective. The opponents I'm talking about include almost every major healthcare interest group, the lobbying groups for doctors, nurses and hospitals, as well as advocates for patients with cancer, diabetes, lung disease, heart disease or birth defects. Each understands that the bill would deprive millions of Americans of insurance. Each has criticized the bill, and some, including AARP, have done more, like organizing phone calls. But they have not come close to the sort of public campaign that would put intense pressure on senators. History shows what such a campaign would look like. In the 1940s, the American Medical Association, which represents doctors, conducted what was then the most expensive lobbying effort in American history, according to Paul Starr, author of a Pulitzer-winning history of healthcare. The campaign changed public opinion about Harry Truman's plan for national insurance, helping doom it. In the 1960s, the same association hired a movie star by the name of Ronald Reagan to barnstorm the country denouncing the proposal for Medicare. It would be the start of socialism, Reagan warned, and invade every area of freedom as we have known it. He lost that battle, but it set in motion his political career and modern conservatism. In the 1990s, the lobbying group for insurance companies ran an ad campaign featuring a fictional couple named Harry and Louise. Sitting at their kitchen table sometime in the future, they lamented how much worse their coverage had become. The ads helped defeat Bill Clinton's plan. Today, however, there isn't much of a campaign, as Starr told me. And it contrasts very dramatically with some of the earlier conflicts. If anything, the case for an aggressive campaign is stronger now. Virtually every big healthcare group views the Republican plan as a disaster.